Right when Avery was handed to her mom sensed a special bond, a mother's intuition that Avery was different. And her parents, as soon as Avery was a preschooler, knew that as a daughter with a penis, they needed to advocate for her rights and that they would allow her to live in her affirmed gender. Early on, they sought the help of a child psychologist so that she could live in her affirmed gender. Currently, only the principal at the school knows that Avery is gender expansive or transgender. And when the signs of puberty started to show, they took her to a gender clinic for kids to start gender affirmation therapy, which is the use of medicines and possibly surgery later on to physically align someone with the gender in which they identify. I am one of those pediatric endocrinologists or kids' hormone doctors that treat children like Avery at Stanford Children's Health. And as a girl with a penis, she is not going to have the chest development or the body shape that she wants. Instead, she is going to make testosterone. Her face is going to develop facial hair. Her voice is going to deepen. Her Adam's apple is going to become more prominent. Her chest will broaden. And of course, her testes and penis will enlarge. Her parents knew that these signs of puberty needed to be put on hold with the pubertal blocker, which is a medication that is used to stop the chemical messages from the brain to the rest of the body that says, hey, it's time to develop. And with the use of a pubertal blocker, I can give Avery another 2 to 3 years so that she can be consistent with the gender in which she identifies. And if she continues, then estrogen can be added to her therapy so that she could have the development that she would want. However, if she should identify as the gender she was assigned at birth, the pubertal blocker can be stopped and she can have the pre-programmed puberty that she was supposed to have. 18 is the age of majority, and many states have laws that prevent sterilization or the permanent removal of reproductive capability. However, these laws were made at a time in which transgender adults could not easily get medical or surgical treatment. And therefore, these laws were made when people like Avery were not being considered. And as I treat Avery, someone who identified as a preschooler and is getting treatment as an adolescent, is the surgical world ready for the changes that are to come? Currently, I don't think so. But if we start thinking about these changes today, I think we can make a difference. 18 is the age in which minors are protected from making permanent decisions about their reproductive health, because the thought is then at 18, they can decide what they would like to do. However, if as soon as pubertal blockers were added and then estrogen was added to her therapy, Avery's testes never developed. In fact, she does not make any sperm. And her reproductive capability to be a biological parent has been eliminated. Her testes are non-functional. And in medicine, don't we often recommend the removal of non-functional organs